92.3 Nigeria Info, Sam Oracle Chinedu here. Before I get into the conversation for this hour, I have a story to tell. Now, I believe, and this is to the best of my knowledge and ability, that I'm a cool person. I'm cool, calm, collected. I almost never lose my cool. Almost, because there are always exceptions. And well, considering that we're humans, you just might be in a position where you get to surprise yourself. Hardly panic. I do worry, but hardly panic. But on this beautiful day, where I took my wife to the hospital, we got in, and of course, having received the award for good husband, the woman was in the car. I drove at top speed, got there. I was in emergency mode, got into the hospital, doctor, nurse, presented the woman, and the nurse, even though she did an amazing job, the hospital is wonderful, there was no sense of urgency. She answered, she got up, she was moving towards her, right? But it's like she wasn't fast enough. There was a part of me that felt she should be faster. And then I raised my voice. I lost my cool. Nurse, don't you see what is going on here? And she didn't answer me. She just went on doing what she was. The woman was eventually attended to, and we had no problems. And later on, I started thinking, was I overreacting? Is it that maybe that was not an emergency that I thought it was? Of course, they did a good job. But the sense of urgency that comes with taking a person to the hospital, is that supposed to happen every time? Is it for particular cases? Are we overreacting? Maybe because, there's an emotional side to it. You're connected to this person. So you want immediately you enter the hospital, everybody just jump down. Hey, what's in the happen? Everybody freeze, stop breathing. We need to attend to this person now. Or maybe we have seen too many movies. When you get into the hospital in a movie, they bring stretcher, they put the person, they are running. Hey, machine is beeping. Maybe that's what I was expecting. I don't know. Having said that, let's now get into our conversation. Some Port Harcourt residents, like me, are weighing in on the lingering issue of hospitals refusing to treat accident victims. Now, this follows a viral video of accident victims rescued from a car crash by a Good Samaritan and taken to the Federal Medical Center in Jabi, Abuja. But we allegedly refused medical attention. Speaking in an interview with our respondent, Port Harcourt residents regretted that such an issue lingers even in 2025, even though saving lives should be a priority for all medical professionals and even non-citizens. Others stress that regardless of the circumstances surrounding an accident, immediate medical attention should always come first.
It's good for them to attend to victims like that. The clinic, we are all trying to save Nigeria from all these evil incidents. They should attend to a patient that comes to the hospital. While attending to the patient, you can make a call to the police. I have so patient to attend to the person by I don't have proof for it in case they are looking for something like that.
It's not okay. When we say then go bring person in emergency, then go abandon the person then go begin the talk say whether not the person thief or no thief, may they help us and they attend to the person to see say they save that life first before they go investigate and know what's happened.
Meanwhile, the chairman of the Nigerian Medical Association (NMA) in Rivers State, Dr. Tamunokuro, says some public hospitals in the country are facing severe staff shortages, poor funding, and an overburdened healthcare system, which has affected service delivery. Speaking to correspondent Martha Okere, Tamunokuro said the number of healthcare workers has reduced due to brain drain.
We still have our hospitals being overloaded with a lot of patients coming in. In addition to that, the issue of funding is also a key issue. The health budget this year is allocating 5.1% to healthcare, as against the 15% by Abuja Declaration. So we realize that many of the public hospitals are not properly funded, and then the required equipment needed to take care of patients. We need to start thinking of training persons that perhaps may provide some form of paramedical services, while the doctors focus on the core aspects of clinical services.
Now, Dr. Tamunokuro further said emergency healthcare is not possible without a comprehensive health insurance system.
insurance is one key area. It's sad that up till now, insurance coverage is still very low. Most of the insurance we have with state-funded insurance and private insurance is mainly focused on those in the formal sector, leaving behind the larger chunk of people in the informal sector. So we really need to take insurance to the majority of Nigerians. And then when citizens have comprehensive health insurance, it is easier for healthcare to become better. So I think these are the key areas that all of us need to focus on.
As you may know, in the 2025 budget, the health sector was allocated 2.48 trillion naira, which represents 5.18% of the total 47.9 trillion naira budget. The 2 trillion allocation includes funding for various areas, including infrastructure, basic health provision fund. The budget, however, still falls short of the budget declaration target of 15% of the total national budget. My guest is Dr. Diamond Tamunokuro, the chairman of the NMA right here in River State. Hello, doctor.
Thank you, Sam. I'm glad being here. Good evening, listeners.
Yes, indeed. It's always a pleasure. It's also very hard to get you, considering how busy your position, your attending meetings, but we're glad you're here.
Thank you.
And before we get into the public, let's touch the private. The story I shared.
Yes.
What was wrong? Was I overreacting by expecting the nurse to have moved faster? Was she responding to maybe the situation? Who was right? Who was wrong? What would have been different?
No, you are not overreacting. You see, when you talk about emergency care, one of the key components is promptness of treatment. So when a patient gets to the hospital for emergencies, we expect that in 1 minute, the patient should have access to care.
1 minute.
In 10 minutes, the patient should have adequate resuscitation and the treatment plan has been drawn out. So that's the standard.
Okay.
So if that is not available in the hospital, it means that several factors could be responsible.
Okay.
And in our own climes, the factors are numerous. It begins with manpower shortages. We are facing a serious brain drain in this country. We've not really seen what we are facing as a country, really, because it will get to a point when we'll begin to have one doctor attending to close to 20,000 of the population. Right now, the ratio in Nigeria is 1 to 10,000, far below what is recommended by the WHO, 1 to 600 of the population. So you realize that the health facilities are overburdened, stressed beyond their capacity. And then you talk about the lack of basic infrastructure in our hospitals, which is a key factor to delivering emergency care to patients that come in. And then the bigger issue is the issue of who funds the care. And that's the issue the patient may not concern himself about because he wants to receive treatment.
Yeah.
But if the patient would receive the treatment that he deserves, then the treatment has to be funded. So someone must fund the treatment. And that's where health insurance comes in. And regrettably, insurance coverage is still less than 10% of the formal sector. So most people in the informal sector have no form of insurance. And then you get to the hospital, you want to have access to quality care. You realize that without comprehensive health insurance, emergency care is impossible.
Okay, doctor. Now, we know some of these issues, maybe not understanding the depth or gravity of it, but we understand there's a brain drain problem. I mean, if you're a good doctor in this country, you very likely would want to practice abroad for obvious reasons. But we also know that medicine is one of the most sought after courses in high institutions. When I was in school, I'm sure when my kids get to school, medicine. That's what everybody wants to study medicine. Lots of people eventually go. Not everyone makes it, but medicine has always been top draft pick, right, among courses.
Yes.
So that means lots of people are studying medicine, which means by extension, lots of people are becoming doctors. Do those stats not affect the shortage in some way?
So it's meant to affect, right? If you're bringing out trained doctors from the medical schools
across Nigeria consistently,
the population of doctors should increase.
At least.
But the question is, how many of those people that graduate are retained? So the key thing is retention. Because when the doctors graduate, right now, while I was in med school, the attraction when you graduate is to specialize.
Okay.
So you choose one area of specialization, then you start what we call the residency training, the postgraduate medical training. But right now, when you ask medical students, the attraction is to write exams that will enable them to practice outside. So you realize that while the system is trying to graduate more doctors, it's difficult to retain them. So you need to look at what are the push factors. And the key push factor, like we know, is remuneration. I mean, doctors in this country are very, very poorly paid. Absolutely. Security, social factors, all come in. But the core is that if you can take care of the people that will take care of your life, then they will be here to take care of your life.
Yeah, I mean, we've had this conversation a couple of times, Doctor, and I believe that our doctors deserve better. However, there is the oath, the Hippocratic Oath. And people are asking that, can there be a place where we draw the line, some balance? Yes, we agree that doctors need more, but could there be sacrifices made where, something is coming to the doctor, maybe not exactly what they want, but something better than what they have, and there is the genuine need to save lives?
So what people are asking for is not so difficult. And let me tell you the bigger truth. It's not just doctors that are leaving. Nurses are leaving. Pharmacists are leaving. Journalists like Sam are also leaving.
I have not seen any. I never see any.
So you see, the solution is simple. If governments at various levels will take health seriously. I mean, in saner climes, for instance, health insurance is comprehensive.
Yeah.
Yeah. And people walk in and they receive treatment. I mean, I've